Hi, today we will be seeing growth and development of children. Most of the students hate learning pediatrics because of two reasons. One, pediatric patients won't mingle with you like adult patients do. And second, learning and assessing growth and development in children is a difficult task. Through this video, I have tried to make it simple. After referring to this video, please go to the patient site with the activities told. Always approach a child with toys or activities. Here, instead of choosing an infant, I have chosen toddler age group because toddlers are an age group which is very interesting when you go to them with activities. So let's move on. The growth and development of toddler, that is from the age group of 1 to 3 years. For convenience, I have classified all the age groups into 17 steps of growth and development assessment, starting from the vital signs: anthropometry, sensory development, dentition, language development, safety and love need, nutrition and sleep need, play need, gross motor development, fine motor development, feeding skills, other skills such as dressing and toileting skill, psychosocial development, psychosexual development, moral development, cognitive development, and spiritual development. And out of this, safety and love need, nutrition and sleep need, and play need. All three needs we need to educate the parents also. Now let's move on. For convenience of learning the growth and development of age group 1 to 3 years, I have simply classified it into 12 months to 18 months and 30 months to 36 months. The age group in between also have common features of both these age groups. Vital signs: 36.5 to 37.5 degrees Celsius is the temperature. Pulse 80 to 130 beats per minute. Respiration 20 to 30 beats per minute. BP 80 to 100 by 50 to 80 mm of Hg. Here I am teaching you a formula for calculating the BP. For BP of 1 to 7-year-old child, age in year plus 90 by age in years plus 52. The topmost part is the systolic one and the down part is the diastolic BP. So for any age group, if you are putting that age, you will be getting the value of BP, which will be normal for that particular age group. Next is anthropometry. We will be seeing 5 measurements: weight, height, head circumference, chest circumference, and mid-arm circumference. Here also formulas are there. For the weight of the child, age in years into 2 plus 8. In kg you need to tell. Height formula is, if the child is more than 2 years, age in years into 6 plus 77. So at this point I need to tell you one more thing. Height at 2 years is 25% of the height. You can see an increase from the birth height. Head circumference, the formula is length in centimeter plus 9.5 by 2. Here you can notice the head and chest circumference for the first year. Soon after the first year it is equal, and as soon as the child grows in the toddlerhood, there is an increase in the chest circumference. And mid-arm circumference, if it is above 12.5, it shows the child is well nourished and it should be in the range of 16 to 17 centimeter. So this is for the anthropometric measurement: height, weight, head circumference, chest circumference, and mid-arm circumference. I would like to tell you one formula also here to calculate the degree of malnutrition. That is actual weight. Actual weight is the weight you obtain with the help of a weighing machine in the ward, divided by expected weight. Expected weight is calculated with the help of this formula: age in years into 2 plus 8. So degree of malnutrition is actual weight divided by expected weight into 100. So you will be getting a value in percentage. If that value is more than 90%, the child is well nourished. If the value is less than 90%, the child has got some malnutrition. So when students are going to the ward, you need to take the anthropometric measurement and assess the malnutrition status also. The sensory development. In this age group, binocular vision is fully developed. Binocular vision means with the both eyes, the child is able to see. The child looks at a picture when you are showing. Sound localization is indicated by head movement in all planes. You need to make some sound and you can see that the child will be looking to that area by turning the head. They can identify geometric forms and can place objects into its appropriate place. So this is a toy with different geometric shape, and if you are taking this to a child's side, the child will be able to place it on the appropriate shape. And this is something like a Snellen's chart which you will be using for a pediatric patient, especially in the toddler age group. The child will be able to recognize the pictures, and picture matching test can be done to assess the visual acuity. Moving on to the dentition, till 30 months you can see the upper lateral incisors. You can see with the pictures also. From 9 to 30 months you can see in the upper teeth lateral incisors have come, and also 13 to 19 months the first molars have developed. 14 to 18 months in the lower teeth first molars have come. And also you need to count the number of teeth in the mouth of a toddler. As the child grows 25 to 33 months, you can see the second molars developing in the upper row, and in the lower row you can see in the 23 to 31 months the second molars have come. There also you need to count the number of teeth. Language and speech development. Here you need to see two things. The receptive language of the child, that is what the language the child understands, what does the child knows, and the second is expressive language, that is what the child speaks. So these two things you need to assess in language and speech development. First age group 12 to 18 months, they comprehend more than they communicate. They will be understanding so much of things, but sometimes they may not be communicating those words. Recognizes names of various parts of the body. They know that where the eye is. So when you are asking, point out your ears, they will show the ears. Point out your hands, they will point out. Response to familiar simple commands. If you are asking to sit, they will sit. You will ask to close the eyes, they will close the eyes. So they respond to familiar and simple commands. Then expressive language, continuous use of expressive jargon. That means there are some words which they themselves have developed and which does not make a sense for you, but for the child they will be very happy using those jargons. True words included with jargon, possibly with gestures. They will be having some words with sense, some words without sense, and they will be using some actions also. Says 2 to 6 words. Names familiar picture or objects such as a ball. Then the age group of 30 to 36, they understand more complex sentences. Obeys one directional command. So one command you need to give to the child, then they will obey. Touch ears, they will be touching the ears. Touch the ears and go run and touch the table. They may not be able to follow these two commands if you are telling at the same time. So for a toddler, always give one directional command. Expressive language. There now at this age group of 30 to 36 months, they don't use jargons. Now they know the true words what they are. They know about 300 words. Moving on to safety and love need. This is a need which you need to educate the parents. Safety and protection from motor vehicle accidents, drowning, burns, accidental poisoning, fall, choking and suffocation, bodily injuries. All these accidents you need to educate the mother, which is possible at the toddler age group. Need independency in play and activity. The parent should not restrict the child. The child has to play. Appropriate toilet training. This is the age group when toilet training needs to be taught. So parents also should be taught how toilet training should be done. Love and affection, immunization, hygiene, development of self-care, toys and articles required for play, proper grooming, encouragement of feeding, dressing and toileting. So all this safety and love need you need to educate the parents. Next comes nutrition and sleep need. This is also something which you need to educate the parents about the food. Continue breast milk up to 2 years along with weaning. Iron supplementation and vitamin supplementation should be given. The calorie, protein, water, iron, calcium requirements you need to tell to the parents. And the child needs a sleep of 10 to 12 hours per day. The play need. The play need in a toddler is passive play, that is, they will be playing alone. Or the play in toddler we can tell as a parallel play. Another child will be playing at the side and this child will not associate with the other child. They will be sitting separately and playing sometimes the same game. So they are doing a passive play, family games they will be involved, and sensory play. By touching the things, they are having the sensory play. You can see in this picture. Second is they will be having exploratory play. They will be exploring the things everywhere in the house. Parallel play continues. Helps put things away. They will be helping the parents in keeping, arranging all the things. Pretends in play. They pretend like a doctor or pretend like a housewife. Pretend like their mother. Motor play. Movement is more involved with them. So these are their play needs, and parents need to be educated what all play materials the child needs and what are the safe play materials which can be provided at this particular age group. Gross motor development. Can see from the picture, stand in position without help. They walk without support. And the gait is wide based. The legs, how it is kept, you can see it is a wide based gait. Then they loses balance while walking, kneels without support, creeps upstairs. The creeping is happening when they are moving up the stairs, throws small objects, removes socks. Dressing skill is also improved in a toddler period. Then as they grow, stands on one feet alone or momentarily. You can see standing on one feet. Walks on tiptoe for few steps upon our request. Then walks up and down stairs on alternating feet step. This time they are walking stairs with alternating feet. They ride a walker and they can throw a large ball over the head 4 to 5 feet. So with the help of these pictures, please do remember in the mind what are the gross motor development of a toddler. Now the fine motor development. 12 to 18 months, They will be building a tower of 2 to 3 cubes. You give some boxes to them, some medicine boxes you give to the child which are empty. You can see how they are opening it. Box finger in hole. This is a very dangerous thing, so all the sockets of electricity you should cover it at home. So they poke finger at the holes. They scribble spontaneously. This is a picture drawn by a toddler. You can see the scribbling. And they make lines with crayon. See how they are holding the crayon with their entire palm. As the child grows from 30 to 36 months, they build a tower of nearly 8 cubes. You can see strokes, vertical and horizontal strokes you can see. They hold crayons with fingers by this time. Here in two pictures you can see the difference. At the earlier time of toddlerhood they were holding it with their entire palm, but as the child grew they started using their fingers. Now good hand and finger coordination has come and they imitate circular stroke and form a closed figure. You can see from this picture the sun, they have formed a closed figure by imitating the circular stroke. So this is the fine motor development of a toddler. Moving on to the feeding skills. They leave dishes on the tray when fed. Something will be kept in the tray. They hold cup with all fingers. Enjoys finger feeding. They grasp a spoon and insert it into the dishes. And as the child grows, self-feeding with occasional spilling you can see. They pour from a large jug but often spills. They can get a drink without assistance. They distinguish between finger and spoon food, chew with the mouth closed, spills a small amount from a spoon, begins to use a fork and holds it with a fist. You can see in this picture. Uses an adult pattern of chewing, that is, it includes a circular motion of the jaw. So when you observe how the child feeds, you can see all these things. Other skills is dressing and toileting skills. Sticks out arms and legs to remove the socks. They indicate when diaper is wet or soiled. They put the arm through a large armhole. As the child grows, they know how to put the arm through a large armhole. Buttons and unbuttons front buttons. They have mastered daytime bladder control and nighttime bladder control also has started. Go to the toilet by self and attempt to wipe and wash their hands. More social or emotional development by Erik Erikson. It is a sense of autonomy versus doubt and shame in the age group of a toddler. Autonomy means the child develop independency. If you go to a toddler, you can see they will be feeding by themselves. They will be dressing by themselves. They like to be independent. So what happens is that the parents, if they allow the child to have the autonomy, the child will be very independent as they grow up. And if there is a controlling parent, later on the child may develop shame or doubt. Psychosexual development by Sigmund Freud, it's in the stage of anal stage. Here we have to focus on the toilet training of the child. Parents need to be taught how toilet training need to be done. The pleasure is experienced by a child in control of bladder and bowel movement. So the consequence I need to tell here, if anal stage properly, if the child is given toilet training at that particular age, we can see orderliness in the child's life. Otherwise, if it is not done, their life will be messy later on. All the messiness you can see in their life. So this is what all this theorists have told. If that is not developed, particular positive thing is not developed, it can result in a negative consequence in the later stages of life. Third one, moral development by Kohlberg. Pre-conventional morality. So pre-conventional morality stage is also divided into two. From 0 to 2 years it is an egocentric phase. In the 2 to 4 years it is 2 to 3 years. It is in the stage 1 pre-conventional morality, that is punishment obedience phase. So with the example you will be able to understand. Egocentric means good is what the child likes and wants. The child cries. If the child is hungry, the child will be crying for 0 to 2 years. If the child wants a toy, the child will be crying. So good is what a child likes and wants. But as the child grows, the child thinks he or she will be punished for doing something wrong. So there is a punishment obedience. That is stage 1 of pre-conventional morality, which develops after 2 years. Next stage is cognitive or intellectual development given by Jean Piaget. The cognitive development, the intellectual development the child is getting through sense organs. That is what is sensory motor stages. So the child is curious about the surroundings. The child will be touching and feeling and understanding everything with the sense organs. They experiment with new behaviors. They begin to act intentionally. For example, when they get a squeezing toy which makes sounds, they try to squeeze the toy again to hear the sound. So that is the sensory motor stage. Then as the child grows from 2 to 7 years, the stage is pre-operational stage. So their intelligence we can understand by the language acquisition, and the child uses symbols for certain action. To come they will be showing some actions with their hand. To go they will be showing some actions. To say bye bye they will be showing some actions. So child uses symbols for some actions. And also a toy doll that may stand for a real baby for them. That is their imagination started. So this is the cognitive development of a 2 to 7-year-old child. So when the child is 30 to 36 months also, this changes you can observe. Then the spiritual development given by Fowler. Till 2 years, undifferentiated or primal faith, we cannot tell anything. But as the child moves from 2 to 6 years, it is intuitive projective faith. The basic idea of God comes from stories, experiences and images through parents and community exposure. On to the growth and development of a preschooler, that is from 3 to 6 years of age. Vital signs. Here for the convenience, I have classified the age group into 3 to 4 years and 5 to 6 years. Some common features also you can observe. Vital signs, you need to see the temperature, pulse, respiration and BP. The BP formula I have already told you for 1 to 7 years. That same formula you need to know, age in years plus 90 by age in years plus 52. Then next, anthropometry. Here there is no need to measure the head and chest circumference. Head and chest circumference is needed till 3 years. After 3 years we will be just checking height, weight and mid-arm circumference. And the formula for weight and height already we know. Weight is age in years into 2 plus 8, and for height age in years into 6 plus 77. Weight is in kilogram and height is in centimeter. Sensory development, the visual acuity is 20 by 20. The child has developed good vision, and this is the Snellen's chart which you can use for a preschooler. Then teeth, you need to count the number of teeth, as well as you can see the jaw and the facial bones of the child begin to grow at this time. So there is a space between the primary teeth. By this age group, the entire primary teeth has come. Language and speech development. As earlier told, two things you need to assess: the child's receptive language and expressive language. Receptive language, they can obey two prepositional commands. They can understand on and under. And the child's age group 5 to 6 years, they can carry out instruction with 3 tasks: wash, dry and sit down. If 3 tasks we are telling to them at a stretch, they will be able to carry out it. That is, their understanding has developed. Then their expressive language, they use 4-word sentences. They will be always asking why. For each and everything, a why will be there. Uses plurals, give their sex and full name. They have a good vocabulary of around 1000 words. Child is intelligible 90% of the time. And the expressive language for 5 to 6 years, they know the primary colors like red, yellow, green. They ask the meaning of words. They repeat the sentences of 12 or more syllables. For example, if you are telling one sentence, Tom is on the porch reading the evening paper, they will be able to repeat that sentence. They will count till 10 and has a vocabulary of 2000 words. Safety and love need, nutrition and sleep need, and play need. I already told you need to educate the parents. So here also safety and love need, protection from motor vehicle accidents, drowning, burns, poisoning, falls, choking, suffocation, bodily injury. Love and affection, how the parents have to provide to the child because that is a need of the child. Immunization and about the hygiene. Nutrition and sleep need. You need to tell about food, what are the supplements which you need to be providing the child, calorie requirement, protein, water, iron and calcium. And also the child needs a sleep of 10 hours per day. You need to educate all this to the parents. Regarding the play materials and play needs. In the toddler you have seen it was a parallel play. Now as the child grows you can see the associative and cooperative play. They like things that move, talk and make noise. They like books about known things, especially about animals. Crayons and paints, they are interested in that. Climbing apparatus, transportation toys, tricycle, doll carriage, play telephone, busy box toys, music recording players, single puzzles, toy dishes, soap bubbles, all these things they like. And as they grow from 5 to 6 years, there also you can see cooperative play. And now another play which has come is competitive. They like to compete now. So some games like that they will be enjoying. They love to transport things in trucks and cars. Then seesaw, slides, jump rope and skates. These type of motor activities they enjoy. Construction of toys, paper dolls, collecting natural specimen for creative activity, color set books and puzzles for quiet play. So they enjoy a variety of playthings. Gross motor development. They walk a straight line. They walk on tiptoes. They run without looking at the feet. They catch ball with extended arms, kick a ball, jumps from a height of several inches, ride tricycle using pedals and turns wide corners. Board, you can provide some activities for the child which they can involve in. They jump rope and jumps over objects. Nurse and doctor kit to stimulate the imagination. Blackboard, chalk, paste, paper, scissors, clay figures and paint, they stimulate their creativity. Sliding boards, swings, blocks of all sizes, garden toys, then tinker toys. Tinker toys means the toys with attachments. They encourage their motor activity. Walk a balance beam, imitating the dance steps. They will catch a ball smoothly with hands. One single foot for 8 to 10 seconds, and they enjoy roller skating. So these are the gross motor development in preschooler, and more of the games and activities we can involve the child and can understand their gross motor skills. Fine motor development. They build a tower of 9 to 10 blocks. They copy a circle. They uses blunt scissors with one hand. Hand preference, you can understand at this age group whether they are using left hand or right hand for their activities. Then they put beads on a string. They will help in simple household tasks. They copies a triangle, they copies alphabets and draw a man with 3 parts. So this is a man with 3 parts the child has drawn, a preschooler has drawn. Feeding skill. They rarely spill when they are using the spoon. They like finger foods. Eat with a fork which is held in fingers. But you have seen in the toddler they used their entire palm. Now they are using fingers. Now they select fork over the spoon when it is appropriate. Other skills, they can put on coat without assistant. They can undress themselves. They can pull pants up and down. They can go to toilet alone. They can brush their teeth with help. Sometimes they will be able to tie their shoelaces. They will be managing their zippers at the back. They wipe themselves independently. They flush toilet after use. They bathe themselves, combs hair with help, and blow nose when needed. Psychosocial or emotional development by Erik Erikson. The stage is initiative versus guilt. For a toddler, it was autonomy versus doubt and shame. As the child moves to preschooler, it is initiative versus guilt. Initiative means the child starts doing certain things. The child is egocentric in thought and behavior. There is an alternate thinking between reality and imagination. They are able to share but always expresses the idea of mine. The thing is mine. I will give to you but it is mine. They are less dependent on parents but needs assurance and help. They tolerate short separation from parents. Significant decrease you can see in ritualism and negativism. A toddler always will be a no sayer, but here that negativism has reduced. Fears the dark. They may have dreams and nightmares. Now their cognitive development, the imagination also started increasing. That is the reason why they are fearing the dark and they have dreams and nightmares. So as the child grows also in the 5 to 6 years, that same egocentric behavior you can see. They are ready to separate from parents. They are independent. They are trustworthy. They have fantasies and daydreaming. But they need parental support and encouragement. Cooperative play, they are engaged. They are very industrious, means they are ready to create certain things. Appropriate Appropriately, they relate to adults outside the families. They know who all are their family members and who are the outside. Then psychosexual development by Sigmund Freud, it is at the phallic stage. So phallic stage, from the age 3 to 6 years, they are aware of the sexual organs. They know their sex. They have a love and hate relationship between the same sex parents. Sometimes they love, sometimes they hate the same sex parents. Masturbation is present at this time. Oedipus complex, that is boy likes a mother, and Electra complex, girls like father, that is seen in this age group of 3 to 6 years. Then comes moral development by Kohlberg, that is pre-conventional morality. Stage 2. So there is a special name for this stage 2, that is instrumental hedonism and concrete reciprocity, that is seen in the age group 4 to 7 years. The children focus on pleasure motive. They consider those actions right that satisfy their own needs than those of others. So whatever is satisfying them, that is correct, and that is what needs more importance in their life. They carry out rules to satisfy themselves. If they hit somebody, so they will be telling some reason. I hit him because he hit me. So like that, they consider their actions right because they are satisfying their needs. They are fair to those who are fair to them, and good behavior earns reward. Cognitive and intellectual development, that is in the stage of pre-operational stage. So cognitive development you can understand by the child's language basically, and they will be using symbols and actions. Then they will be considering toys like real things, but sometimes they show some difficulty to tell the series of action. If you ask them to tell step by step the things happen, they may not be able to tell. And also, if two objects or more than two objects if you're showing, there will be a difficulty in concentrating on things. And as the child ages from 5 to 7 years, according to similarity, they will be able to classify the objects. So if you are telling, take the objects with round shape, and they will be taking the objects. So they will be able to classify the things. Accurately describes the events from 5 to 6 years. They are able to tell how the events happened. They know the cultural differences, and also they know the differences in other people. For example, they know who is an elderly person and who is an adolescent, so they know the difference. Time orientation is improving. They know it is going to get dark or it is going to be night. They know the things. Using words with increased meaning, and they are very curious. All these things shows their intellectual development. Last, the spiritual development of 2 to 6 years, it is intuitive projective faith. It already had started from the toddler period. So here the basic idea of God comes from stories, experiences and images through parents and community people. That is about the growth and development of a toddler and preschooler. I again would like to tell you something. Always go to the patient side with toys and activities. These activities you do will make the hospital experience of the child also a better one, and you will be learning growth and development nicely. Please do subscribe to this channel to learn more things about nursing. Thank you.